today's visit with patient 24601 based on badge information. We are going to be examining the visual field, the ocular motive function, an eye examination with a focus on the orbital with trauma, and a color vision field test. Perfect. So, hello there. I do hope you're doing well this evening. I am Dr. Nerve, and I am the ophthalmologist and eye trauma specialist here in Dream City. And just taking off my glasses really quick, I do see that you have a bit of a bump on your head, which is causing you to lose a bit of your visual field, correct? Yeah. Very typical when that comes to trauma. So, let's begin the examination. Do you feel any vertigo at all, or any signs of eye pain? Perhaps are you seeing double vision? No. And may I touch your face? Thank you. Just taking a look here, see. If I put pressure around your eyes here, do you feel any sensitivity? No. Okay. Okay. So, first step, I'm going to add some eye drops for dilation. They'll kick in about 10 minutes. You won't feel a thing, I promise. So, 4 drops in each eye. Just relax. I'm just going to gently apply this to each eye. Just don't move, okay? So, just 1, 2, 3, and 4. Good. The other eye now. Okay. And 1, 2, 3, and 4. And just try to blink that out. Good. So, we're going to begin with a visual field test. Now, I'm gonna get my glasses back on for this, but what I want you to do is sit still, don't move your head, and look at me with your eyes. Don't look anywhere else. So, sitting back on my chair now. Do not move your head and don't move your eyes. Just keep your eyes on me. And I'm going to move my hand into a visual field, and you let me know when you see my hand actually in your eye line. Okay? Good. So, good. 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 Great. Great. Now a bit closer now. Gets a bit more difficult the closer I get, so. Good. 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 Great. Good. visual field with dynamic vision is spot on. Okay. Moving on. We're going to do a visual field test with this. Do you see this in my hand? Yes. And what color is this? It's red. Perfect. I'm going to cover one eye, and I want you to let me know when this gets into your visual field and when you don't see it anymore. Perfect. So, I'm going to start with this eye first. Just going to cover it. And just let me know when you see it. Okay. Great. And do you see any double vision with that? No. Okay. Great. And now, perfect. Other eye, I'm just going to cover it very carefully. So, great. Marvelous. And great. Marvelous. Thank you. I'm going to get some gloves on now, and I'm going to do a very thorough ocular eye examination, okay? Great. I hope you're doing fine. So, first, I'm just going to look at each eye. Good. So, covering one of the eyes. I'm just going to shine this a couple of times, okay? Okay. Looking for pupil contraction and dilation. Okay. Good so far. I'm going to look now just a bit deeper onto this eye, so just don't move. Just going to take a quick look when I do look into the eye there. And I do see that there is something that we could be taking a look at from this critical condition. Okay. Could you look up for me? Okay. Now look down. Okay. Look to your left and to your right. And then could you look diagonally left, right, and then diagonally down left and down right. Perfect. Other eye now. Just going to take a quick look. So I'm just going to take a look at this eye, and I do see your eye is wavering. This is what the doctor said prior from your base reports. So I do notice though that this is caused by swelling and impact from the top of the eye. Nothing to be too concerned about. Caused from up there, so okay, I'm going to take just a quick look there, don't know. Just going to look. Could you look up and down to your left and to your right? Okay, wavering of the eye is very strong, so I don't want to cause any vertigo in the eye. Okay, so what I want you to do now is we're going to do something called follow the light. Good. And do not move your head or chin when I do this exam, as it will fluctuate results. Good. So, just hold still and follow the light. just follow it. Okay? Just follow the light. Testing orbital function. Okay, wavering of the eye scene, but I would say horizontal and verticals are not as bad as diagonals. Other eye? You okay? Good. So, just follow the light. Orbital function fine. Okay. Now together. Follow the light. Thank you. So, lateral functions, non-assessed. Perfect functioning for lateral and vertical. Horizontal and eye with the trauma is because of pressure to the eye. So, your eye is just overworking because there is a pressure on top of it right there from the trauma. It's nothing serious though, but we're going to continue doing some visual field tests and some color assessments to see if there's anything I should be concerned about. Okay. So, next, I'm going to be doing a visual field test for eye ocular function. This will help better assess an ocular view and the orbital eye. So, going to get just a bit closer. I do apologize, but what I'm going to do is first I'm going to use my gloves, then Q-tips to assess if your eyes are responding correctly to things that are up close. Good. So, first just going to bag. Okay. Okay, are you seeing double vision at all? No. We're going to get cotton rounds now. Okay, here we go. Okay. 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 Now to eyedrop into your eye. This is actually going to add a yellow tint to the eye. And it will help you see better when I do visual color field tests. 2, 3, 4. Blink, blink, blink. Good. Now to the other eye. 2, 3, and 4. Blink. Good. We're going to grab a cotton round and just wipe very carefully. Okay. Okay. So we're going to let that soak and sit in. Okay. Now I'm going to do something called a numbers test. Good. I'm going to raise numbers around your visual field. You let me know what you see, okay? Good. For example, that's 2, that's 3, etc. Good. So, look at me. Don't move your head. Don't look anywhere else, okay? Good. So, here we go. 1, 2, good. Good. Great. 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 Awesome. Now I'm going to do something where I'm going to just flex my fingers, and you let me know which side, left or right, I flex my fingers on, okay? Good. So, here we go. Great. Good. Great. Good. Great. Good. Okay. Good. And did that cause double vision at all, or a sense of vertigo? No. So, dimensionality working perfectly, and visual ocular function is working great. Good. I'm gonna get my gloves back on very quickly. We're gonna do the color assessment now. So, I'm going to change the lights in this room to different colors, and you let me know what you see. I'm going to cover one eye at a time. Good. So, got a fancy remote here. Going to just cover one eye, and you let me know what colors you see. Blue, perfect. Red, yellow, light blue, green, pink, normal. Great. I'm going to cover the other eye now. This one could be the one that has impairment, particularly to warmer tones and cooler. Here we go. Blue, normal. Light blue. Unknown. Okay, that's purple. Warm. Okay, that's pink. And okay, warm. That's red. And changing color effect. So, shadowing. Understood. And back to normal. Okay. So, this is very good to know that color selection is working, at least both eyes when in connection to one another. So, I'm going to do a very thorough eye cleaning now on the eye that has experienced some trauma. So for the eye cleansing, I'm going to get a mask on. Okay. I'm going to get a cleansing round. I'm going to add an antibiotic cleanser and an anti-inflammatory to help with the pressure put on the eye from the injury. So, going to get my anti-inflammatory here. We're going to apply that directly onto the eye. So just don't move and blink, blink, blink. Good. Now we're going to add the secondary medicine, which will help with visual field and to not get as much vertigo in the eye as it will slow down the eye visual field. So, just going to cleanse that very quick. I won't put a lot of pressure on the eye, just going to just okay. 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 Are you doing okay? Good. Last but not least, we're going to apply some ointment to the eye area to reduce inflammation. Good. So, grabbing a bit. Just going to apply a bit of that onto a round. Just going to very carefully just apply that onto the eye, like medication. Just going to very carefully apply that onto the eye like a medication. Just going to take a look, just make sure that everything is going on. Just make sure that that is going to be very carefully looked at. Okay. Now I'm going to just bandage and put pressure on the corner of the eye to help the swelling be reduced. So, with a brand new cotton round, I'm just going to apply pressure to the area. And I'm going to get some gauze to wrap around it so that it stays. So, just going to get that there. Okay. Now, my dear, are you feeling even a slight bit better? I hope so. And are you feeling any type of double vision, vertigo, unbalance, unevenness with the eyes? No. Okay. means that my examinations are over. It was a pleasure to meet you. I am Dr. Nerve, and if you do feel like your eyes are wavering, please let us know and we can do reassessments and reevaluations for your health, okay? Good. Relax, and I'm going to prescribe some anti-inflammatories for the eyes. Good. Anti